What is the best strategy in Brazil for the typing blood donors?
To answer this question is not so easy, but to answer we need to establish a strategy. It's very important to think about how much you want to know about blood donors, the typing. Brazil is a big country, colonized by Portugal and other European countries. You are very mixed people. They brought slaves from Africa and found their native Indians. Then you are very mixed. It depends on parts of the country. You have different characteristics. If you are sure the best strategy is to type all the variants, like G positive, just to protect the recipients for immunization, you can use several monoclonals combinations with IgG and IgM, because you know now the polyclonal reagents are not available.
Okay, so what did you decide to do?
I think that's important to know more about blood donors, the typing. I don't have doubt about blood bags. All the variants need to be considered G positive and the labels identified like G positive. But it's very important to remember that blood donation is altruistic and voluntary action. And in my opinion, blood donors deserve to receive more information about their real G typing. They can be a possible future patients or maybe pregnant women. I don't know, it's not easy, but I think so.
So what do you observe in Brazil regarding the typing?
As I talked about, depends on Brazilian states, we can find different frequencies of the antigen. For example, in Rio, in Southeast, only 10% of the persons are D negative. In South, like Santa Catarina, 15%. If you go to Bahia and North, you will find just 6%. Then, Shirley Castilho published some results about the frequencies in Brazil. But my question was, what's the frequency in Rio de Janeiro?
So, how did you solve this problem?
That was the point. In recent years, many companies have been offering the possibility to make a double D-typing test, mainly in gel cards or microplates. However, most of these reagents provide information just about the D6 antigen, because in fact the risk of early immunization is higher than other G variants. But I wasn't sure that D6 was very prevalent in Rio de Janeiro, and I'd like to look for more possibilities.
Okay, so how did you choose the best anti-D reagent?
Well, in our lab we choose and you use two different monoclonal reagents. One DGIgM, another one IgG clone, different clones. And the IgG clone can identify weak G or partial G just using indirect antiglobulin tests.
Okay.
Then, if you have some different results in immediate spin, you can think about to be a weak D or partial D. We adapted these reagents to using on PK equipment on microplates.
Okay. So what are the main difficulties regarding these specificities?
Okay. In fact, using these clones, we can predict some results. Okay, D2, D4, D6, other one. Even some weak D. But to to define the D specificity, we need to do serological or molecular tests using other techniques.
Okay.
Using these clones, we may make a study using these clones. You detect among 5,400 donors 20 divergent results, 0.4%. After using kits composed by 6 different monoclonals and molecular tests, we can find 10 weak D and 10 partial T. We found the more prevalent, in fact, was D4, 7 cases, but we found to D5 and D3 and some weak D, special DF1. The frequency of the D variant was 0.2% using these 2 clones. The big problem is serological reagents to partial D identification are very expensive, and to make molecular tests not so simple to do it. Even so, I needed to be an effort to clarify the D typing, especially in female blood donors. Among these 10 cases, 5 were female donors in childhood bearing age. I think we should protect female donors for a possible immunization in case of pregnancy.
Okay, so what are the problems for D-typing patients?
HEMORIO is a blood bank and also a hospital. We treat only patients with hematology disease. Our main problem concerns to sickle cell patients. The frequency of D negative in these patients is only 6%, mainly due to a pseudogene. They have also other problems because there are polymorphism in RH system. Regarding this patient, we observed that some patients typing like G positive had made antibodies, and using the same strategy as we using the donors, you can find some partial D results, D3, D5, D28, D3C also. Some experts prefer to use just only IgM for typing D patients, but in this case, in our case, I think it's not a good strategy because they will be typed like G positive. They are using on the past using several reagents and also polyclonal reagents. And I think it's important to see better the D typing for this patient. We always also type into others antigen from RH systems. We type in, you offer transfusion always with blood message also to big C, little c, big E, and K antigen.